Hello, everyone. The other day, a patient asked me a few questions after the surgery, after the penis enlargement surgery. Why is it swelling here, pain here, and so on? I explained it to him. I text him every single time. I told him everyone asks about these. He said to me, you better make a video on this. What happens after the surgery? I mean, there wasn't a separate video like that, really. There's a video like things you need to look out for after surgery, but there's no video of me talking about what happens day by day. I said, okay, I'll prepare a video on this so these patients know what happens when they watch this video, what they will experience every single day. Now, you know, I have a notebook, a black notebook. I wrote down there. This video may be a little long, so I'm going to take a look at that now. Now, in the evening, you had the surgery. What happens that evening? We performed the surgery at 9 a.m. and discharged the patient at 4 p.m. At 4 p.m., the patient goes home with dressing. Or if he leaves abroad, for example, before the outbreak, we were sending the patient we operated on at 16 to home abroad with 9 to 8 p.m. They could leave in the afternoon, but now they usually either go to the hotel or the number of the patients coming from abroad has decreased. Let me tell you that there's also this. Usually they are discharged at 16 p.m. and the patient goes home. Generally, we have more patients from Turkey or from Istanbul in comparison to before. Now, patients generally complain of pain. Where? They don't feel the pain at the location of the surgery. Let me tell you that. First, they feel the pain at the place where the fat is taken out, usually in the belly, in the legs. So you ask if there's any pain at the location of the surgery, they say no. So around the penis also you won't have much pain in the penis. Apart from that, there are no problems of urination because the tip of the penis is open during the medical dressing. The penis is completely wrapped. At the bottom there's a medical dressing, but the tip is open. Therefore, there's no problem with urination. However, if the operation was performed with spinal anesthesia, sometimes we perform the operations on the spinal, numbing the waist. If we have performed such an operation, these patients may have difficulty in going for the toilet for a few hours that evening due to numbing of the waist. The bladder is also paralyzed, so the patient cannot urinate. Until now, I think there was only one patient when we had to make the patient spend the evening lying down and we had to put a catheter. The bladder did not open. The man couldn't urinate. We put a catheter and had the patient in bed that night. But I think he was a patient. I don't remember that much. We usually do it with narcosis using general anesthesia. We performed the 9 a.m. operation in the morning. We discharged the patient at 4 p.m. He could urinate comfortably when he went home because the tip of the penis is open since the dressing is at the bottom. Apart from that, in cases of buried penises, sometimes like this can take place. The dressing can move towards the tip of the penis can be retraced a little after surgery and the medical dressing can be contaminated at the tip. If it is contaminated with urine, we remove the dressing and apply batikon to the stitches. The area should not get wet for 3 days. If the dressing is dirty, the patient removes the dressing and the batikon is applied to the stitches. Once a day is enough. I think there's no need to close there after the dressing when it's open. Apply batikon just a little bit off the tip and it is important not to take a shower. In some cases, there may be some contamination and bleeding in the dressing, especially if an operation was performed on the testicle or under the penis. Or there has been a testicular sagging correction. There may be some bleeding in that area under the penis in stitches placed on the testicles. The dressing can get bloody and dirty like this. For example, usually if we performed on a surgery in the testicles, like testicular recovery, I have the patient spend the night at the hospital. I change the medical dressing in the morning and then send them away to home. Because in the morning it becomes bloody and contaminated. it is very good to bleed in the testicles. So there will be definitely a little leak that contaminates your dressing in the next morning. I put these patients to bed one night, change their dressings, and send them away next day. Now, what could happen the next day or the third day? I'll tell you what's going on. There's a swelling under the head of the penis. Almost every patient texts about this. They say, "Hey, doctor, my penis has edema under the head. Swelling, did something happen wrong?" There's nothing wrong going on. The edema fluid drains down. The edema fluid is fluid. Wherever there is at the bottom, it flows down and accumulates. The penis is an organ standing down like this. The edema fluid drains down, and where does it accumulate? It accumulates under the head of the penis. There might be a swelling in that area. It is normal. Don't take it as it's strange. There's nothing wrong. The body sucks the edema fluid and throws it away. Some patients say that the fat has flowed down there. The fat we injected is not that fluid. It doesn't flow. It's the edema that is fluid, and it fills through the tissue and accumulates downwards. The edema is liquid. Fats don't move easily. In that respect, do not think of such a question. Are the fats replacing? That's not something that can happen. Other than that, first 2 or 3 weeks, the patients may wake up at night with pain. The reason for this is this. Now, when we elongate the penis, we cut the suspensory ligament and we push the penis out. It's not enough just to cut the hanging tie. We make the stitches on the back of the penis that push them out, so that it stays far away from the bone as possible and it doesn't come back. If we don't make these stitches, the penis may come back and stick again to the same place. That's asked a lot also. You cut the suspensory ligament, but can it come back again? If the stitches I mentioned are not there, it can come back and hold again. It's true. What are these stitches for? It pushes the penis out. We make the stitches that push it out like a corset from the back. Now, when the penis gets erected, it holds up and strains those stitches behind it. So, if the patient gets an erection while asleep and this forces the stitches, what will happen? He will wake up in pain. If he has lots of trouble in this regard, if he says that he wakes up with pain every night, I can't sleep or something like that, then we start the medicine to stop that erection. We start a medicine that stops the erection. This will be effective in 3 or 4 days. We recommend the patient to use this for 2 to 3 days. After he stops taking the medicine, the effect will pass after 4 days. The medicine taken once a day. Apart from that, patients cannot have an intercourse for 3 weeks. As you know, since we inject the fat, there's a process of transformation of this fat into fibrous tissue. This takes about 3 weeks. At the end of 3 weeks, the patient can have an intercourse again. Because of its fat properties by then, it turns into fibrous tissue, meaning it's dead, such that it becomes a single pierce with a paste-like texture and does not mat into blood anymore with the movement. It has no fat feature. It may be painful in the first relationships because of the stitches we put on the back of the penis. That's it. In fact, we had a patient who came back from northern Iraq. I mentioned about him one of the videos. We operated on the patient and sent him away. 1 month later, the relatives of the patient called me. They said our patient's place of surgery was infected with a germ. Well, such a place would not be infected 1 month after the operation. If it's due to a germ, it would be caught within the first week. But they said to me, our patient went to a urologist specialist. The urologist examined the patient and said that this place was infected and sent the patient back to us. The man came back to us from northern Iraq. I examined him and there's nothing on the penis. It looks like as I left it. This is the pain issue. I asked, where did I get this idea of an infection? Why did you go to a doctor? The man had pain in his first relationship and went to a doctor. The doctor looked at the penis and it appears to be large. It looks bigger than normal and there seems to be the pain. He said this place was infected. This is a sign of infection. It is big, swollen, plus there is pain and so on. The man came back to Istanbul in vain. There could be pain in first intercourses. Keep that in mind. Patients say we feel pain for a few hours, but it's getting less and less. I'm getting used to it, so it's not a big problem. After the operation, there's no intercourse for 3 weeks. After 3 weeks, there might be some pain in the first intercourse. This is normal. We are expecting this. No problem. Apart from that, let me explain to the showered issue. Now, the patient doesn't take a shower for 3 days. We say not to take a shower for 3 days immediately after the operation. On the evening of the 3rd day, for example, Monday morning, we spent at the hospital. We get discharged Tuesday, Wednesday, Thursday. Thursday evening, the patient takes off the dressing by soaking it under the shower. When we get the dressing, comes off easily. Take a shower, use shower gel or soap water. It's not harmful. On the contrary, it's a disinfectant. It is okay to wash using shower gel or a soapy water on the evening of the 3rd day. Wash it and even wash it well, of course without harming it. Cause the stitches are just holding, of course rinse well at the end of your shower. Rinse thoroughly with tap water, and when you get out of the shower, compress the towel and dry it firmly. In fact, if you press a paper towel after drying it with a towel, it will dehumidify thoroughly. After that, the place where the stitches are can stay open. It doesn't need to be covered again. What we don't want is to see water and pool. Especially in summer. We tell the patients, salty water and pool water are prohibited for at least 2 weeks after the operation. Why is that? Sea and pool water is not considered clean. It is considered dirty. Soapy water and so on while taking a shower is effective as a disinfectant. But pool and sea water are considered contaminated. Therefore, going to the sea or the pool is prohibited for 2 weeks. After taking a shower, there's no need for medical dressing again. The wound can stay open. After that, you can take a shower whenever you feel like it. Take a shower every 3 days, every week. We don't have any limitations. Take as many showers as you want. But when you get out of the shower, dry it. Don't let it stay wet. Staying wet prepares the ground for infection. It prepares the ground for germ infection. Dry it thoroughly. That's what we want. The first 3 weeks. Also in the first 3 weeks, intercourse is forbidden. Why is it forbidden? Because the fat tissue we injected in those first 3 weeks is still fat. And if there's a movement on the penis, it mixes with the blood. So there are 2 things that make the fat mix with blood and not hold on. First, movement. Movement in the operated area. The second is the fat being of poor quality. So what do I mean by poor quality? You got fat from the belly, but it came with edema. It came out very liquid. Such fat doesn't hold very well. Most of it, it's lost. We cannot do anything about it. It has something to do with the composition of the fat. I'll explain it in another video. I'm going to shoot a short video about that. I'll talk about this in more detail there. What we have is movement. We don't want any movement on the penis for the first 3 weeks. Look, it is okay for the penis to get an erection alone. It could be a morning erection or something like that. In fact, I think it makes the fat distribute more naturally. But don't move it. There should be no back and forth movements for the penis. Massage, masturbation, intercourse, even one of those patients ask me, oral sex. These are all no-nos. Unfortunately, the patients need to be a little patient after the surgery. The fat needs to turn into fibrous tissue. How do we know that it has turned into fibrous tissue? Because we receive biopsies from many patients at that time. Fat doesn't remain as fat in there. Fat isn't fat. It dies and leaves a fibrous tissue behind. This is what provides thickness around the penis. Unfortunately, some surgeon colleagues of mine keep trying to keep the fat alive. This is so ridiculous. There are even published articles on this subject. This is not very well understood in the world. People have tried to keep the fat they have injected into the penis, etc. This is so silly. I will prepare a special video about that. I will go into a great detail on this subject there. This issue alone is proof that we are far ahead of the world. Some people wrote on an article, sent it to the medical journal saying, we tried to do this and that to keep the fat alive we injected into the penis. And the editor of the magazine has also read, approved and published that in the magazine. It's a big medical journal. When I've read it, I couldn't believe my eyes. Fundamentally wrong article. Very wrong. From the very root, it's very wrong. I'll explain the reasons of it all in that video. There's also another very strange thing. Well, sadly, this surgery is misunderstood in so many ways. Most doctors have not actually comprehended the basics of this surgery. Even the name. For example, this year there was going to be an aesthetics forum in Istanbul called ISEV. I was going to hold a presentation there about the misconception of this surgery. Unfortunately, the congress was cancelled due to the outbreak. We couldn't give that presentation. Actually, I'm going to prepare a video about this issue, but there's something that I'm amazed at. Last year in November 2019, there was a congress in Istanbul about genital aesthetics. Obstetricians, urologists, psychiatrists, and plastic surgeons attended this congress. I was the only one from plastic surgery at the congress. Mostly there were urologists involved in male genitalia, blah, blah, blah. The urologists made a presentation. The man says after the operation for 3 weeks, intercourse is prohibited. And he says, I recommend a massage. He said that the intercourse is a no-no, but he doesn't know why. Because he recommends a massage right after that. The reason that the intercourse is prohibited is so that there's no movement in the penis. Watch the videos of foreign urologists. You can find some videos on YouTube. The man recommends a massage, but he says no intercourse for 3 weeks. This is the silliest thing I've ever heard. I cannot believe it. They didn't understand the nature of the surgery, so they don't understand what we do for these reasons. Look, the reason that there's no intercourse is to prevent the movement. If there's a movement on the penis, the fat mixes with blood and disappears within 3 weeks. The fat has to stay alive and hold there. Let me be more clear. If a doctor recommends a massage to you after the operation, it means that he doesn't understand or know about this operation. It means he performed the surgery with a sketchy information. Massage, intercourse, masturbation, oral sex, all of these are forbidden. There will be no movement on the penis at all. It can have an erection on its own. The problem is having a movement on it. Let's come to the stitches. Now, we use a self-melting sutures all the time. These stitches fall off in about 3 weeks. Usually they fall off. You don't need to do anything else. Take your normal shower, wash that area with a soapy water. Look, washing is also very important. Why is that? One day a patient called, "Doctor, I think this place has caught a germ or something." I said, "Come here and let's see." The patient came, either the man didn't wash it, or no soapy water touched it ever. He just poured water on it. So there's a rash. Even the scabs and blood clots are still there. It has been 3 weeks. So don't be afraid. Wash it so it gets clean. It's good to wash it. Stitches, as I said, usually fall off after 3 weeks. Some of them don't. If there are stitches that does not fall out, I'd say either get it removed at the nearest hospital or come, I'll remove it. If the patient is in Istanbul, if he is nearby, he comes to me, I take out the stitches. There's no point in stopping the stitches after 3 weeks. At most, it prepares the ground for infection. So if there are stitches that does not fall off in the 3rd week, you have to remove it. Another important point is the stitching line. This is a subject that I get such interesting messages about. Now listen, the patient opens the dressing in the shower on the evening of the 3rd day, takes his shower, then sends me a message. The message came to me several times in the same way. Different patients have sent the same messages. They say, perfect job, doctor. It looks nice. It looks as big as I wanted. But he says, the stitching looks so bad. Why is that? It is not aesthetically pleasing. He says, looks like killed stitches. Now that's why he says it. The stitching we put at the bottom of the penis we do it plumbing and fluffing. It is a fluffy stitch. The reason is this. In order for the stitch in that area to heal well, we need to do it this way. Because the wound collapses as it heals. Now, if I make that stitch properly today as the patient wishes, in fact, the patients say it's like a glued with laser or something. It is perfectly straight. The threads run from inside, not visible from outside. The patient likes such stitching very much. But after 3 months, there's a pit. Stitches collapse. In order for that stitch to be flat on the ground, we have to stitch it like that from the beginning. As the wounds heal, the stitching collapses and becomes level with its surroundings. The result we aim for is 6 months. Now, because the patient looks and sees the wound puffy, they say, you stitched up like a kilt doctor, and text me saying, what kind of stitching is that? I also put this on my website in a small box, explaining why we make this stitching this way. So let me mention it here as well. The suture will look pumpy, but as it heals, it will gradually collapse and level with its surroundings within 3 to 6 months. What we aim for is the outcome. We always aim for the outcome after the wound healing in plastic surgery. Our doctor had a nice saying. He used to say plastic surgeon is a surgeon who sees the future. So you make the stitching, you can look and see how the stitching is going to appear tomorrow and after 6 months. This is the work of a plastic surgeon. He does this job by calculating how the wound is going to be healed. That's why we stitched like it's bumpy. Today, its appearance is not important to us. We need to sew it like that so that when it collapses, it will level with its surroundings. So we suture it like a quilt. But ask us why we do it like that. So there's a reason for that. Now here's the most important issue. 1 or 2 months after the operation, the patients usually send this message and they say the following. Hey doctor, the penis size is good, nice, it is obvious when it's soft, but I cannot see it in erection. The elongation is not there so much. Now listen, we used to think like this. We are separating the penis from the bone. We push it forward. In erection, the penis is trying to approach the bone again. We thought that's why the elongation is not so obvious in erection. In fact, during the pandemic period, we had the chance to download and read all the articles we haven't read when we were at home in quarantine. I saw an article that wrote about this exactly. The man says that some patients complained about. He says that the elongation cannot be seen clearly during the erection. They wrote, we think this is because the penis is approaching the bone again. This used to be my opinion as well at least 5-6 years ago. I don't think so today. Why? Now, the patients who complain about this are always cases in the 2nd month and the 3rd month after the operation. I've never heard such complaint from a patient at a later period, after the 6 months or so. Now, I think the reason why the patients make such complaints is this. The Y-shaped stitch you make at the bottom of the penis causes stiffness in that area. Because the stitches you see is actually not just the stitch alone. Below, we went down front of the pelvis to cut the suspensory ligament. It is quite deep. You have 7 to 8 centimeters depth easy. After cutting the thigh, we sutured 2 walls together with the stitches from inside. We held the penis in front. We placed pushing stitches like a corset. There are lots of stitches inside. There is serious hardening in that area because the wound is healing there. Wound healing hardens that area. What happens then? In some patients, the bottom part of the penis becomes like a stone. Now what we call an erection is actually blood filling the penis, and the penis comes to an erection thanks to the elasticity of the tissue there. It results in elongation. Now, if the bottom of the penis is hard but not elastic yet, you cannot see the length during the erection. That is why I think the complaints of the patients saying that elongation is not visible during erection in that early phase are based in this hardening. When they reach the 6th, 7th, 8th months, this hardening becomes softer and the penis regains its former elasticity. The patients then sees the full length during the erection. So for you to fully see the elongation completely, the healing has to end. It takes at least 6 months. It is very logically correct, because you can see the result of an operation only when the tissues have completely regained their former elasticity and the wounds heal. You cannot see the elongation before the tissues soften and the elasticity of the penis regains its former condition. Think of it like a balloon. If you stick adhesive tape to one side of the balloon, if you break its elasticity and try to inflate it, it will not inflate. It can't. That's why such complaints in the early period are meaningless. I recommend that you wait for at least 6 months. You see the erection, but this is the last part that heals following the surgery. It takes 6 months to see the elongation to a full extent. That's why I say that the ideal form of the surgery as follows. Both lengthening and thickening are performed together for the patient. At least 6 months, sometimes even a year passes. What happens in this year? There may be some melting in the fat tissue. Patients who come from abroad who have animal fat in their nutrition, lard, tail fat, etc., they don't experience any melting. But in the patients who have vegetable oil like olive oil, corn oil, sunflower oil in their nutrition, there will be some loss in fat. During this time, it will experience a decrease in thickening. It will disappear away as melting occurs. But since the tissue at the bottom of the penis will soften, you will see full elongation. What happens then? At the end of the 6 months or 1 year, the patient comes once again and another fat injection is given. We complete the missing fat. We don't touch the length. We have already done the lengthening and the patient now sees full elongation as the tissue has softened. When we complete the thickening with the second fat injection, you will get the full result. Therefore, I think that an ideal clean penis enlargement surgery is in the form of first lengthening, thickening, and then one more session of fat injection after 6 months or a year. You can get the best results this way. Its effect also lasts for many years, especially if the patient is someone who consumes animal fat in his diet. If tail fat, lard, etc. are in their nutrition, then there's no loss in the fat you inject. Then having the surgery for one time is enough. You don't need to do a second operation. After 5, 6, or even 7 years later, I've seen some patients and their condition is perfect. There are many cases where there is no melting in the fat. But as I said, people consuming animal fat as a lifestyle, since the fat in their body is very resistant and it doesn't melt and disappear. In such cases, there's no need for a second session of fat injection. I speak for our country because vegetable oil is used more in our country, and this causes tissues to become more fragile. They call it the Mediterranean diet, using olive oil. What happens with these patients? Cardiovascular diseases are less common because this type of adipose tissues is not very resistant. The vascular occlusion effect is less. In such patients, there is some loss of fat injected into the penis. That's why I recommend one more fat injection after 6 months or 1 year.